Good afternoon, everyone. It is Monday, March the 16th, 2020. It is currently 1:47 p.m. Central Time, and I'm coming to you live from Victory Baptist Church located in Ovalo, Texas. Well, I guess we can all say that right now we are living through history. We are witnessing history before our very eyes because what is happening right now around the globe is going to be talked about 30 years from now, 40 years from now, 50 years from now. People are going to be talking about what happened in the year 2020 on planet Earth as we were all dealing with, struggling with, trying to figure out how to deal with COVID-19, the coronavirus that is spreading around the globe. People are dying. People are being placed in quarantine. Places are shutting down everywhere. Different states, especially here in the United States of America, are passing restrictions on gatherings of, no more than 50 people, no more than 25 people, no more than 30 people. Businesses are being shut down. Movie theaters are being shut down. Bars are being shut down. Restaurants are being shut down. Broadway's being shut down. I mean, it is crazy what is happening. And in some parts of the world, entire countries, for all practical purposes, are being locked down. Travel is being restricted. It's a crazy time to be alive, but we need to remember we are witnessing history. You need to pay attention to what is happening, especially young people. The young people are going to be talking about this 40, 50 years from now when many of us will be long gone. They will be talking about what happened in the year 2020. Help them understand what is going on. Use it as a time. For many kids, they're not going to school. Use it as a time to teach. Pull out a map. Show them where this country is, where this country is. Use it as an opportunity to learn about the world. Use it as an opportunity for them to witness history in the making. And most of all, be careful and be safe. And while you're trying to be careful, while you're trying to be safe, while you're trying to use this as an opportunity maybe to teach, to learn, to witness history, one of the things that you're going to need is information. And you need good information versus bad information. You don't want fraudulent information. You don't want to be listening to some person that you know from high school on Facebook. No, you need to be listening to medical experts. You need to be listening to people who know what they're talking about, who've studied this kind of thing, and you need good information, correct information, reliable information. And so what I want to do in this very brief live broadcast is at least point you to one source of information. Now, with all sources of information, you always need to listen, verify, check other sources. So I cannot just give you one source of information and say, this is the most authoritative, this is the most correct. What I can do is try to point you to a decent resource, and then it'll be your job to continue to listen and to verify and to check. But I don't know, the other night I was listening to podcasts. I think I was listening to the ABC News Hourly Update. And at the end of their ABC News Hourly Update podcast, they mentioned a new podcast that they are beginning. And I was like, oh, okay. They are creating a new podcast that the entire focus of the podcast is the coronavirus, COVID-19. And each day they're going to release a new episode where they speak to medical experts, give you an update about what is happening, and basically answer all your questions in regards to COVID-19 and the coronavirus. I have the information about the podcast right here. Let me find it here. I've got 900 things open on my iPad here. Here we go. COVID-19, what you need to know. COVID-19, what you need to know from ABC News. Here is how they describe it. Each day, ABC News answers your questions about COVID-19, also known as the novel coronavirus. The ABC's chief medical correspondent, Dr. Jennifer Ashton, and other experts respond directly to questions submitted by listeners and viewers, and our team of correspondents and medical contributors keep you up to date on the latest news related to the virus. Now, I wanted to share this earlier, but I was waiting to the most recent episode, and 43 minutes ago, they released a new episode, and I'm going to at least play the beginning of it for you, or at least some of it, so that you know what it sounds like and that you can find it. What you need to do is do a search for COVID-19, what you need to know on probably any of your podcast apps, or you can do a search on Google for COVID-19, what you need to know podcast, and it should pull right up, and you can listen to it via web, online, like on the internet, or you could use a podcast app to subscribe to it. The website for the program, if I can get it to open, is abcaudio.com, abcaudio.com, ABC Audio, all run together, abcaudio.com. As soon as that page opens, it says ABC Audio, we're there for you. And then it says COVID-19, what you need to know. You can subscribe on Spotify, Google Podcast, Apple Podcast are the three they have here. It's also available on TuneIn. I know it's also available on the Stitcher podcast app. It's also available, on what other podcast apps here? The Breaker podcast app. I'm assuming it's available on Pocket Cast as well. But please, subscribe to it. I mean, it doesn't look. You may not be a fan of ABC News. You may not be a fan of a lot of the news media, but at least gather as much information as you can. And it's easy to subscribe to a podcast, and then you check each day going, oh, here's the latest episode, and listen really quick. You can fast forward through parts of it if you want. Just go through it and at least hear what the experts are saying. Hear what is being reported. Hear the information. Information is important. Information is important. So many people are running all over the internet, making all kinds of crazy claims, foolish claims, fraudulent claims, claims based off ignorance, not based off information. During a time when you're living through a global pandemic, information is king. Credible, authoritative, correct information is king. Get the information to protect you, to protect your family, and to protect others. I keep emphasizing this from a Christian perspective. Even if you think, who cares? I'm not worried. And you want to be all kind of, bold and brave and think that you're, immune to anything happening to you. Okay, that's fine. You can have that attitude. But please remember, even if you get it and you don't care if you get it, the issue is you passing it on to other people who may care that they get it or possess underlying health issues that could make the coronavirus fatal to them. So you may not care, but hopefully from a Christian perspective, you at least care not to kill someone else. So take it seriously. Please get information. When you're listening to, say, this podcast, COVID-19, What You Need to Know from ABC News, which we're about to listen to some of it, even if you subscribe to this podcast, make sure you pay attention to local news. Know what's happening in your local area. That's very important. Has there been cases confirmed in your area? What are the local schools doing? What are businesses doing? My daughter, who's currently in Boston, she's in a grocery store right now. She sent me a text message saying she was told, and we cannot verify this, that the stores are going to be shutting down in 72 hours. Well, if that's true, now you see why people are stocking up on all kinds of supplies. Okay, now you can see if that is true. If stores start shutting down and they start restricting travel, or in your particular local area they start closing down, or if someone in your family is test positive for COVID-19 and your entire family has to quarantine, then you can't self-quarantine or self-isolate. You can't leave to go get supplies. So that's why people are stocking up. So make sure you get information. Make sure you're thinking about this rationally, logically. I'm not saying panic. I'm not saying fear. Facts over fear. As a Christian, yes, we trust in God. We believe God is in control. We believe God has a sovereign purpose in all of this. We trust him in all of that. But trusting God does not mean that you act foolish. Trusting God doesn't mean that you run out to test God. We do not test God. We do not try to tempt God to say, hey, God, prove to me that nothing is going to happen to me. That's not what we do, okay? If you remember when Satan tempted Jesus to throw himself off the temple, he says, do not tempt God. Do not test God. Do not tempt God. That's not the way we're supposed to conduct ourselves and the way we're supposed to act. That's not the way Christians are supposed to handle this. And you have many Christians making a lot of foolish, almost this, like they're trying to prove how spiritual they are and how they don't have fear. Well, trying to prove how brave you are, or trying to prove that you do not have fear, doesn't mean you go act in a foolish manner when you're testing God. You do not do that. That's not the way we are to act. So we need reasonable, rational, thoughtful people right now. Take some time to realize you're witnessing history. Use it as a time to teach your children about the world. You can talk about geography. You can tell them about the virus. There's lots of things you can do, but please, most importantly, get information. Get information. And so to help you get that information, I'm going to mention this podcast, and I'm going to play part of it for you. It is the COVID-19 What You Need to Know from ABC News. The website, abcaudio.com, abcaudio.com. If you cannot find this podcast for some weird reason, email me at newsif@yahoo.com, newsif@yahoo.com. I will send you the link to the page. Please subscribe to it. Share it with others. And again, listen and then verify and check their information with other information you're getting from reliable sources. President Trump is supposed to be making a press conference, from what I heard, believe at 3:30. I don't know if that what time zone, probably 3:30 Eastern. If that is true, then he should be, I think around 30 minutes from now, he should be doing, a press conference live. I don't know how he's going to address everyone. Lots of speculation of what's going to be said. Lots of speculation that there's going to be some serious restrictions coming down on possible travel and other things. Lots of speculation. So here's what you do if he does give the press conference at 3:30, and if that does happen, don't listen to everyone tell you what he said. You listen to what he said for yourself, all right? But for now, let's sit back and listen to a little bit of this podcast from ABC Audio, ABC News, COVID-19, What You Need to Know, and then you'll get an idea if this is something you want to subscribe to. So here we go.
This is an ABC News special, COVID-19, What You Need to Know. From ABC News headquarters, here is correspondent Aaron Katursky.
Countless Americans are now holed up at home. Economic activity is severely limited. The Supreme Court is postponing oral arguments. The SAT has been canceled. These disruptions to public life in the United States are part of what the World Health Organization called a rapid escalation in social distancing measures, part of the global effort to outwit novel coronavirus. We know you have a lot of questions. Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health outside Boston, is here to answer them, as posed by my colleague Amy Robach.
The first one we have is, how does a pandemic virus die out, and how will we know when it is coming to an end? An important question.
Okay, so Amy, a pandemic, basically, first of all, it's here because it's highly contagious and we don't have immunity to it. So it can spread around the world, okay? When it dies out is when enough of us become immune to it, and then hopefully as the weather changes and we start getting some warmer and drier weather, the hope is that the virus won't survive that as well. Now, that's still an if. We don't know that for sure. So we're also, remember, there's surveillance going on. So we're watching the numbers increase. We won't know that we've peaked until the numbers start declining, and then we'll know that we're on the right track. Now, hopefully there won't be a second wave of this.
Right.
But the hope is over the next 6 or 8 weeks, we'll start to see improvement.
All right. Well, we can all certainly hope that. And Dr. Ellerin, here's our next question. Is it advisable to shower as soon as you get home from outside activities?
Again, I think the most important thing is good hand washing. That's most important. Obviously, we want to shower and keep clean, but our hands are the things that if it's infected, we forget to wash our hands, we touch our eye, our nose, our mouth. That's how we become infected. So I want to emphasize hand washing.
Yeah, I mean, I've heard people come in, Lysol their shoes, put their clothes straight in the washing machine, and then jump in the shower. Is that too much?
I mean, I don't want to say it's too much. I think you have to individualize that, but I don't want to make a broad recommendation that we all have to do that. I think our hands are a major portal of infection to ourselves, so that's the key. Soap and water or alcohol-based gels, they both work.
All right, next question. Is it dangerous to open up the mail that's been delivered to your house or your apartment?
Okay, so I think there's a question of how long this virus lives on surfaces. What I'm going to say is that it's not entirely clear, but I want to emphasize, I think the majority of transmission is occurring through close contact. 3 to 6 feet, someone coughing on you, sharing drinks with someone who's infected, shaking hands, which we shouldn't be doing right now. That type of close contact is key. I think, I don't think that we have to sanitize our mail before we open it, but I think importantly, after we open our mail, we want to clean our hands. Again, back to the hand washing.
All right. No, I mean, that's what it's all about. This is a question I think a lot of people have because so many of us have older relatives. This one comes from a woman who says, I'm 78 with health conditions. Is it unseemly to request family and friends do not visit until this crisis passes?
I think that I think that makes sense. I really do. Because remember, this virus overall is mild. We are very hypersensitized to it right now, and we're focusing on the most critical cases. But for the most part, it is mild. But the elderly and people with weakened immune systems, those are the ones that this virus is going to be most severe in. So I think that person I think that makes sense.
All right. And this is a question from somebody, say we all kind of are wondering if it happens to us. So they ask, if you test positive for COVID-19, what are the best treatments while you are quarantined at home?
Okay, so if you test positive, again, most people have very mild illness, don't need any specific treatment, just like it were the flu. You can, you want to hydrate. If you have fevers, you could take something like Tylenol and basically, but specific antivirals that are experimental right now, we're really only using for hospitalized patients with more severe illness.
And Dr. Ellerin, speaking of hospitals, I want to ask you this because there's a lot of confusion. If you're feeling unwell, if you have a fever, should you go to the hospital? Should you go to your doctor's office? Because obviously you now potentially are impacting people in the waiting room and healthcare workers on the front lines.
So this is a key question, Amy, and what's really important is that you want to make a call first, okay? If you feel like you have moderate symptoms, you want to call your primary care provider. If you have mild symptoms, you just want to stay home and do the things we talked about before. If you have more moderate illness and you're concerned, you want to call your primary care provider. Let them know that you want to be seen and hear from them. They may tell you to put on a mask before you go to see them in their clinics. Now, for patients with severe illness, respiratory distress, confusion, you can't get out of bed, you're so weak. Of course, then you have to think about the emergency department. Again, if you could have a family member call first to say you're coming in so they can prepare you before you go, that's key. Once we're prepared, we know how to handle you.
Dr. Todd Ellerin taking your coronavirus questions with my colleague Amy Robach. The World Health Organization said there's been a rapid escalation in the number of cases. More cases and more deaths, in fact, in the rest of the world now than in China. And in this country, there are more than 3,800 cases, at least 71 deaths. Containing the virus, of course, would have been the best option. But absent that, the experts say social distancing is now the next best thing. More places where the public gathers are shutting down. That includes O'Lunny's Irish Restaurant and Bar in Midtown Manhattan, where Maureen Lunny is the manager. She's with us now. Maureen, what's the plan?
Well, we got word last night around 6 o'clock that we had to close by 9 a.m. We're a typical restaurant and bar, so we don't have enough takeout service to warrant staying open. I think that's quite typical a lot of restaurant and bars. So it's quite limiting what will be available. And so now we got another word from Cuomo that we need to shut at 8 p.m. today. So there's a lot to do to shut down a business. So we're working on it now.
And tomorrow's St. Patrick's Day.
Yes, this is unbelievable. St. Patrick's Day is actually, for us, a week long. So we've missed out on a fantastic weekend. There's so many events in and around St. Patrick's Parade. Really, the whole month of March is a celebration of Irish culture. So there's a lot of loss economically as well as socially and culturally this month.
What are you going to do about your employees?
They see that we're trying. We were trying to stay open, and here's my conflict of, are we putting people in danger by being open? So we spoke with the staff first. Anyone who's uncomfortable with working or feels scared about working, that please take off, no problem, and we'll see you on the other side of this. That you definitely feel like, what is real? What is the real threat? We were told by the government to work at 50% capacity, and then other people are told to stay home. I think that was a conflicting message there. I'm glad they made this decision. It was difficult to operate with the loss of the theaters, loss of the parade, everyone working from home. Our customers are just simply not around.
Yeah, the domino effect has been incredible.
Yeah, it affects everyone, yes.
Yeah. Maureen, how long can you hang on?
Well, we were going to give it a go, but then, again, you feel conflicted. Like, what is the danger? Am I working here, and am I endangering myself as well? So, I really needed the government to say what this is, what we should do. It wasn't fair to say to everyone else, stay home, and then let teachers and restaurant employees go to work. So I'm glad they made a decision to close the schools. Everything seems a bit last minute, though. People do need time to prepare for these closures. So the next thing, of course, is so we close. Now, what about rent? Tenants are obviously hit hard by this closure, and the staff of tenants. So what happens? I'd like to see the government create a dialogue with landlords to generate some kind of rent relief for the same time period that we are forced to be closed.
Yeah, hoping that the government comes up with something in that regard. Maureen, we wish you a lot of luck. Thanks so much for your time today. As
we're saying, we will march again. So hang in there, New York.
Amen. Maureen Lunny, the manager at O'Lunny's Irish Restaurant and Bar in Midtown.
There you have it. That was just a little preview of COVID-19, what you need to know. The podcast that was recently started by ABC, ABC Audio, ABC News. They're the ones putting it out. It's supposed to be released each afternoon. I would tell you to subscribe to it so that, again, you get some of those questions that were asked and answered. Maybe they're questions you have. Maybe they're questions other people have. Maybe they're questions you didn't even think about, but you get the information. And then when you see someone posting something maybe on social media, you can say, no. Here's the latest information based off this or this or this. And then you have the link to the podcast that you can share with other people. So please subscribe to the podcast. I get nothing from it. It's nothing to do with me. I'm trying to help you out. Subscribe to their podcast. Listen to it every day. Subscribe to other podcasts that you find to be informative about this information. Please be cautious of fraudulent information, of conspiracy theories. Take this serious. Get information. Take the necessary precautions. Be prepared. And witness history as it unfolds before our very eyes, all right? I just wanted to bring you this information. If you have any questions or need links or anything, email me at newsif@yahoo.com, newsif@yahoo.com. I will stop with it. I just wanted to do one quick live broadcast to bring you this information. I'll be back with some other live broadcast here in just a few minutes. But email me if you have any questions. Be safe. God bless. Thanks for listening.